Hi, I'm Mia Tate, and I'm going to be doing my presentation on congestive heart failure. The learning objectives for the student is to identify the signs and symptoms of congestive heart failure, the risk factors for congestive heart failure, and how to treat congestive heart failure. I'll now introduce myself to my patient.
Come in.
Good morning, Miss Hudson.
Good morning.
Okay, how are you doing today?
Oh, not so good.
I'm sorry to hear that. Well, I'm Mia. I'm going to be your nurse today. Can I ask what brought you to the hospital today?
Well, I've been having some shortness of breath and some lower extremity swellings in my legs.
Okay. Do you have any history of hypertension?
I do.
What about high
diabetic.
cholesterol?
And also CHF.
Oh, you have history of CHF? Okay. What about the family history? Does anyone in your family have hypertension, CHF?
Yes, my mom and dad, history of hypertension and also congestive heart failure.
Okay. Well, how long have you been diagnosed with CHF?
They diagnosed me about 6 months ago.
6 months ago? Okay. Do you perform like daily weights at home?
To be honest with you, I'm kind of non-compliant, so I haven't been weighing myself like I should. My dietary intake is not like it should be, so, I know I need to work on that.
Okay. Have you noticed any recent weight gain?
I have. I know I've gained 4 pounds this week, I noticed.
This week? Okay. Do you have any history of smoking?
I don't smoke.
What about drinking?
I do drink.
Okay. As far as that's drinking alcohol, so how much alcohol do you drink daily, would you say?
I would say 2 margaritas a day.
2 margaritas a day? And that's in combination with other fluids also? Do you monitor your fluids at home? Are you on any kind of fluid restrictions?
I am on fluid restriction, but I haven't been following it.
Okay, and do you know what your fluid restrictions are?
1,600 cc's.
So 2 margaritas a day, and then you don't even count, and you don't know how many ounces of margaritas you drink either.
No, ma'am.
What about any antihypertensive? What kind of drugs are you on at home?
I take lisinopril, and I'm also on Coreg.
Okay, and are you compliant with those?
Yes, ma'am, I do take my medications.
Okay. Well, I'm going to go ahead and get your vital signs, and then we'll do an assessment on you.
Okay. How long have you been nursing?
Oh, I've been a nurse for almost 16 years.
Wow.
Yeah. I've learned that I like it pretty much.
Yeah, it's not for everybody.
No, it's not. It takes a special person to get to nursing and stick with it. But I guess that's all in going into nursing school, too. You learn if it's for you or not. Because a lot of people, if they get it and they don't like it, that's when they quit. I wouldn't want to have went through all those years and then just do it for nothing. Uh-oh. Putting on your lower arm. Oh, this machine. Yeah. Okay, good blood pressure, 123/87, kind of borderline hypertensive.
Okay.
And your heart rate looks like it's pretty low at 52, and that's usually a sign of CHF also when you're bradycardic.
Okay.
Okay, initially with the assessment of CHF, you want to, on inspection, you're inspecting for paleness, level of consciousness. So I want to look into her conjunctiva of her eyes, check her oral mucosa for paleness, and also while she's sitting up at a 45-degree angle, I want to assess her jugular vein distension. Normally, you're not supposed to see any pulsation of the veins on either side. If you do, that's indicative of venous congestion with CHF. And that's when you'll see the bulging of the veins. Okay, now I'm gonna go ahead and listen to you. Deep breath. Okay, when auscultating for breath sounds, with CHF patients, you'll hear rattles and crackles when they have fluid on the lungs. Now I'm going to listen to your heart sound. Normally heart sounds are going to be just S1, S2, the lub dub sound, but if you hear S3, S4 gallop, that's indicative of CHF also. And also your carotid arteries, I want to listen for a bruit. And it's good and clear. Okay. Now I gotta assess your pulses. Sometimes with CHF, as you know, you'll have irregular pulse because you're either in vasoconstriction or with vasodilation. You want to assess your nail beds for circulation. The capillary refill should be less than 3 seconds. And you're going to assess your pedal pulses also. And while I'm down here, I assess her lower extremities for any edema, which is signs of CHF. And we rate that on a scale of 0 to +4. Okay, let me look around the ankles. And at the same time, I'm assessing the skin for any discoloration, any sweating, cold or clammy feeling. Okay, well, you look pretty good on the assessment. And let me see, let's go over what your treatment has been at home. Okay, when is the last time would you say you weighed yourself?
I weighed myself 2 days ago.
2 days ago?
Mm-hmm.
So how much did you weigh then?
I was 152.
Okay, and today on admission, you were 156.
Mm-hmm.
So I would say you are in probably CHF exacerbation. So we're gonna put you on the protocol of daily weights, monitor your fluids, and usually we'll probably put you on a 1500 cc restriction. Probably some little light exercises, walks and things like that to help get fluid off of you. We don't want you to have any kind of overexertion because signs of CHF exacerbation could be the labored breathing, shortness of breath. Have you been having any of that?
I have been.
Okay. And that's another reason why we need to monitor your fluid intake, because when you get the extra fluid on your lungs, that's what causes the shortness of breath.
Okay. Will I be sent home on any other medication?
Well, the doctor probably will put you on some vasodilators, some
I don't want to be put back on that Lasix. Lord.
Well, that's one thing that you need to take to keep the fluid off of you.
Oh, right. Okay.
Mm-hmm. And the doctor, he'll monitor that and make sure that you're not putting too much out, so you end up in kidney failure. So it's important that you take that Lasix so you don't have the fluid overload.
Okay.
Okay. Do you have any other questions?
No, ma'am. I think that's it.
Okay. So, as far as the medications, let's see, what do you take? Lisinopril,
Correct.
Mm-hmm.
I take a vitamin.
Okay. Okay.
And potassium.
And potassium. Okay, have you ever been on Lasix before?
I have been.
Okay, but you stopped taking it?
Yes, ma'am, because I would have to get up all through the night going to the bathroom.
Was the doctor aware that you stopped taking it?
No, ma'am, he wasn't.
Okay, well, that's why we need to educate you even more
Okay.
on your medications and make sure you're taking them properly.
Okay.
Okay,
I
well,
understand.
it was nice meeting you today, and if you have any more questions, don't hesitate to call me.
Okay, thank you so much.
You're
Miss Faye.
welcome.